If you are over 60 years old, stop doing these 4 exercises and switch to these other 4. Many people over 60 years old start having problems they didn't used to have. Lower back pain, difficulty climbing stairs, knee pain, and so on. The problem is that they've normalized this as something normal to happen, something age-related. The fact is that it definitely shouldn't be this way. These problems are frequently the result of doing the wrong type of exercise, or no exercise at all. The truth is that at this stage of life, we already have enough experience to know that evolution isn't about doing everything, or doing more, but rather doing what works in a suitable way. That's why today you'll see not only 4 exercises that can cause problems for people over 60 years old, but also 4 safer options that will target the same muscles without straining your joints. But before we begin, please leave in the comments your name and the city where you're watching our content from. Exercise number 1, deep squats. The deep squat, where you lower yourself until your thighs are parallel to the floor or even lower, is frequently celebrated as the king of exercises for the legs. And rightfully so, it works practically all the lower muscles of the body. However, after 60 years of age, this exercise can become a real villain for your joints. With natural aging, our knees begin to show cartilage wear, reduction of synovial fluid, and in many cases, some degree of osteoarthritis. When you perform a deep squat, the pressure on the knee joints increases exponentially. Studies show that it can reach up to 7 times your body weight when we are in the lowest position of the movement. Additionally, the natural flexibility of the hips tends to decrease with age, which means that to compensate for this limitation, many people end up curving their lower back during the movement. This compensation transfers tension to the lumbar region, an area already vulnerable after decades of use. Remember that back pain that appeared out of nowhere? Perhaps it wasn't so random after all. Another common problem is stability. With the natural decrease in muscle mass after 60, body balance becomes compromised. A deep squat requires considerable coordination and stability. A small mistake can result in falls, which represent a much greater risk at this stage of life. I'm not saying this to scare you, but from personal experience, I've seen many students in this age group suffering from chronic pain by insisting on exercises that their bodies no longer accept. And there's more. Blood pressure. During deep squats, there's a significant increase in momentary blood pressure. For those already dealing with hypertension, this pressure spike can represent an unnecessary risk, especially if you're doing the exercise with additional weight. Now, let's talk about the perfect substitute, the chair squat. The chair squat is a brilliant alternative that preserves practically all the benefits of the traditional squat, eliminating the risks. In this exercise, you position a stable chair behind you and perform the movement of sitting and standing without necessarily completely touching the chair. The presence of the chair serves as a natural range limiter and at the same time, a safety net that drastically increases your confidence during the movement. To execute it correctly, position the chair against a wall to prevent it from sliding. Stand in front of it with your feet shoulder width apart and slightly turned outward. Keep your chest up. Activate your core and initiate the movement by pushing your hips back, as if you were going to sit. Lower yourself until it's comfortable, ideally until you almost touch the chair, and then return to the starting position, focusing on pushing through your heels. The great benefit here is that you work exactly the same muscle groups, quadriceps, glutes, hamstrings, and core, but with much less joint stress. The chair eliminates the need to lower beyond the point where your knees form a 90-degree angle, precisely where joint pressure skyrockets. Additionally, the presence of the chair provides a visual and tactile reference that significantly improves your technique. A common mistake I see is when people let their knees collapse inward during the movement. Always keep your knees aligned with your toes. To start, I recommend 2 to 3 sets of 10 to 12 repetitions with a 60 to 90-second rest between them. As you gain strength and confidence, you can progress to 4 sets. The beauty of this exercise is that it is extremely functional. After all, sitting and standing is a movement we perform dozens of times a day. By strengthening it, you are directly improving your quality of life and independence. Exercise number 2, high-impact running. Many see running as the best cardiovascular exercise, almost as a symbol of youth and vitality. And there's no doubt that running brings numerous benefits to the cardiovascular system. However, for those who have crossed the 60-year threshold, this exercise isn't always the wonder it appears to be. What many don't realize is the cumulative impact that decades of physical activity cause on our musculoskeletal system. Each time your foot touches the ground during a run, your body absorbs an impact force that can reach 2 to 3 times your body weight. This force starts at the feet and ankles, propagating through the knees, hips, and spine. Over time, this repetitive impact can lead to a series of problems, especially when our tissues no longer have the same recovery capacity as before. Among the most common problems are shin splints, patellar tendinitis, Achilles tendon strain, inflammation, and even stress fractures. Additionally, bone density naturally decreases with age, making bones more susceptible to fractures, a risk that simply isn't worth taking. There's also the question of balance. Running requires coordination and stability, and with the natural decrease in muscle mass, the risk of falls increases considerably. A fall at 30 might mean a scraped knee. At 60, it can result in serious fractures, especially of the hip, which are unfortunately associated with high rates of complications. There's still an important psychological factor. Many adults feel an internal pressure to continue running as they associate this activity with maintaining youth and cardiovascular health. They end up ignoring signs of pain and discomfort, thinking of the old saying, "No pain, no gain." This mentality can be dangerous when it leads to ignoring clear signals that the body is sending. I'm not saying you need to completely abandon cardiovascular activities. Quite the contrary, just that there are much smarter alternatives. The first smart alternative is the stationary bicycle. Unlike running, cycling is a low-impact exercise that practically eliminates repetitive trauma to the joints. When you pedal, your weight is supported by the bicycle seat, drastically reducing the load on knees, hips, and spine. The only mistake you should avoid on the bicycle is setting too high resistance from the beginning, which can overload the knee joints, exactly what we're trying to avoid. The bicycle primarily works the quadriceps, hamstrings, glutes, and calves, but in a gentler and more controlled manner. Additionally, being a seated and stable exercise, the risk of falls is completely eliminated. I recommend starting with sessions of 15 to 20 minutes 3 times a week at moderate intensity. A good parameter to measure intensity is to think that you should be able to maintain a conversation during the exercise without becoming breathless, but with some effort. Over time, gradually increase to 30 to 45 minutes. Alternating between periods of higher and lower intensity, interval training, can maximize cardiovascular benefits without excessively increasing exercise time. The second option is moderate walking. Walking regularly strengthens the heart, improves blood circulation, helps control weight and blood glucose levels, as well as strengthening bones, crucial for preventing osteoporosis. Start with 15 to 20-minute walks on flat terrain, and as you feel comfortable, gradually increase the duration and add routes with slight inclines. Ideally, accumulate at least 150 minutes of walking per week, according to recommendations from the World Health Organization. Exercise number 3, traditional push-up. The traditional push-up is undeniably an efficient exercise for upper body development. However, for people over 60 years old, this variation can present a series of risks. First, the position places a significant load on the wrists, With aging, it's common to develop conditions such as arthritis, making this position potentially painful. Additionally, the stabilization strength needed to keep the body in a straight line is considerable. With the natural decrease in muscle mass and core strength, many people end up compensating with the lumbar region, which can result in back pain and even more serious injuries. Another critical point is the pressure exerted on the shoulders. The shoulder joint is complex, and after decades of use, can show wear on the rotator cuff. The traditional push-up, especially with inadequate technique, like letting the elbows flare out too wide, can aggravate pre-existing problems or trigger new inflammations. Fortunately, there is an excellent alternative, the incline push-up. This is a modified version that significantly reduces the degree of difficulty and stress on the joints without compromising the muscle benefits. In this variation, instead of supporting your hands on the floor, you support them on an elevated surface, such as a wall, counter, table, or the back of a sturdy sofa. To execute correctly, position yourself facing the chosen surface. Place your hands on it at shoulder width or slightly wider. Step back with your feet until your body forms a diagonal line with the floor. The closer to horizontal your body is, the greater the challenge. So start with a more vertical incline and gradually progress to lower surfaces as your strength increases. Keep your core engaged, your back straight, and lower yourself by bending your elbows until your chest approaches the surface. Then push back to the starting position. This variation works exactly the same muscle groups: chest, triceps, anterior deltoid, and core, but with two great advantages. The load on the joints is significantly lower, and you can easily adjust the level of difficulty. A common mistake is when people let their elbows flare out too wide during the movement. Keep your elbows at an angle of approximately 45 degrees relative to your body. For beginners, I recommend 3 sets of 8 to 12 repetitions 3 times a week. As strength increases, you can progress to lower surfaces or increase repetitions. Exercise number 4, lying leg raise. This is frequently recommended to work the lower abs. However, this exercise can be particularly problematic for people over 60 years old. What many people don't realize is that a large part of the work is done by the hip flexors, not so much the abdominals. Since hip flexors tend to be chronically shortened due to prolonged sitting, strengthening them without proper stretching can contribute to an anterior pelvic tilt, which in turn increases lumbar lordosis, the exaggerated curvature of the lower back. Another critical problem is the pressure exerted on the lumbar spine. When the legs are raised extended, especially if the abdominals aren't strong enough, the lumbar region tends to arch, increasing compression on the intervertebral discs. For people who already have some degree of disc degeneration or spinal stenosis, this movement can trigger or aggravate lower back pain. There's also the factor of intra-abdominal pressure. For those with hernias or abdominal diastasis, this increase in pressure can exacerbate these problems. The alternative used here will be the seated march. It is a brilliant exercise that effectively works the abdominal muscles, especially the transverse abdominis, without overloading the lumbar spine or the hip flexors. It's a movement that mimics walking, but is performed in a seated position, eliminating impact and drastically reducing stress on the lumbar region. To perform correctly, sit on the edge of a firm chair with your spine erect. Engage your core as if you were pulling your navel toward your spine. Maintaining this abdominal contraction, lift one knee toward your chest, then lower it and repeat with the other knee, alternating in a movement that resembles marching. The movement should be controlled and relatively slow. To increase the intensity, you can lift your feet slightly off the floor when they're not in motion, or hold the position with the knee elevated for 1 to 2 seconds before alternating. This exercise works not just the abdominal muscles, but also promotes coordination between breathing and movement. Additionally, being performed while seated, it completely eliminates the risk of falls and reduces to 0 the pressure on joints. A common mistake is letting the spine curve during the exercise. Keep your chest up and spine in a neutral position. I recommend starting with 3 sets of 10 to 15 repetitions for each side. A 65-year-old student who suffered from chronic lower back pain reported significant improvement after replacing traditional abdominal exercises with a seated march. After 6 weeks of regular practice, she noticed a decrease in pain, an improvement in posture, and ease in performing daily tasks. "It's as if I've regained the stability I hadn't felt in years," she told me. If you like this, and also want to discover 6 isometric postures that are capable of completely changing the lower part of your body, we've left a video appearing right now on the screen. Don't miss it. Thank you for watching. Until here, and may God bless you, my.